Thank you very much, Mr. Chairman. Welcome, Dr. Oz, and welcome to your family. The big concern I have about our healthcare system is it costs too much. It's a real disgrace that we spend the most and get the least. I mean, so many other countries, with all the problems they may have with their healthcare system, citizens are not anxious about whether they can afford the care that they need. Here, that's not the case. And one of the big problems is that private equity, pharmaceutical pricing power, device manufacturer pricing power, consolidation in the industry, all of this has made the cost of healthcare brutal. It's brutal on taxpayers. It's brutal on employers. In Vermont, we have a lot of small employers. They're paying sometimes $40,000 for a family plan for their employees. They can't afford that. And it's brutal, obviously, on individuals. So I believe a major responsibility that you would have in your job would be to fight the excessive charging. I'll ask you a little bit about pharmaceuticals, but you said you're going to pursue that. In his first term, President Trump said he favored a reference price for drugs. So, we're paying 3, 4, 5 times for the same drug that they buy in Canada or in Europe. Would you support reference pricing so that we don't get ripped off compared to everybody else, even though we do the research?
Senator Welch, thank you very much for taking time to meet with me before this event and for that question. President Trump has been very clear that he wants me to reduce drug prices, not just that the government pays, but also for beneficiaries. International reference pricing is a way of doing that.
All right, here's what I think we all need. We have got to get a fair price, and it's not a fair price when we're paying 6 or 7 times what they're paying for the same thing in France or in Canada or wherever else. Okay, so I'm just going to stop here, but say that is absolutely top of mind. President Trump has indicated a concern about this, and I hope you follow through. Second, Medicare Advantage, it sounds good, but it's an incredible ripoff in some cases. The Wall Street Journal did a expose, incredible investigation about what United Healthcare did. And what it found is that they packed diagnoses. It was to their advantage to have a person seeking Medicare Advantage to have numerous diagnoses that really didn't necessarily require treatment. They provided doctors and nurses with checklists of possible diagnoses their patients, and they paid them bonuses for completing these checklists. So they'd pay a doctor or a nurse more if, when they examined me, they found more things wrong with me. And this resulted in about $84 billion excessive overpayment in Medicare Advantage plans. These practices, it's going to be your job to crack down on that. Are you going to have any tolerance for that kind of ripoff from our insurance companies?
No, I think you've identified a place where a system which was, in theory, a good one. Medicare Advantage is a community health focused effort.
I understand that. I just want to stay, I don't mean to interrupt, but I just want to stay on this. We cannot afford to have the healthcare system be taken over for private profit when it doesn't provide good service at an affordable price for our citizens. You agree with that?
I agree, and I think the upcoding in Medicare Advantage programs has become the best example of this out there, and it's something that is addressable, and I pledge, if confirmed, now we'll go after it.
All right. You're a very nice person. I don't want you to be nice when it comes to dealing with this stuff. All right? So put that nice guy stuff behind you. That's Oprah.
I'll be surgical.
We need a fighter. No, I'm serious about this. We just can't afford this. Another thing that's happening in healthcare is private equity. One of the things that you said is that physicians should be free from corporate ownership. I'm sure you say that as a physician deep in your soul because you know it's about you helping a patient. And now private equity is owning a significant percentage of doctor practices, and private equity has made 352 acquisitions in 2010. In 2020, 10 years later, it's 937. And what they do is they downsize, squeeze, and put the total emphasis on profit instead of patient care. Is that private equity invasion of the healthcare space of concern to you for patient well-being and cost?
The one point I'd like to make is, as you point out, doctors who used to be generally completely free of corporate ownership, over the last decade, the doctors that are free practicing has gone from 70% to 30%. So
Right.
now most doctors are owned by a large insurance company, a hospital system, private equity. We have to have a mechanism to disrupt the incumbents. The only way to go after the big guys is to have smaller people who are willing to put money into initiatives that could conflict with their, or go after their business models. Private equity is one of the ways you can do that. Yes, it can be misused. Absolutely agree with the point that it's been abused,
Well,
but this is an opportunity too.
All right, thank you. Here's my hope, because we can't measure this now, but we've got a starting point. In my expectation is you'd be able to come in 6 months, let's say, and report on whether there's progress on all these things. Squeezing out the ripoff in private equity, squeezing out the ripoff in Medicare Advantage, and having lower drug prices. So I yield back, Mr. Chairman, and I thank you for the little extra time.